Monitoring your blood sugars is a very important part of diabetes control. Without those numbers, you have no idea, you have no clue, and your doctor has no clue as to how well the therapy is working. There's a very important correlation about the types of food and the amount of food you eat and the types and amount of medications you take. Type 1 diabetics make no insulin whatsoever. So all the insulin they take by injection is replacing what their body should be making. It's very important for them to check their blood sugars 2, 3, 4, even 5 times a day so that they know how the food they ate interacted with the medication or the insulin they took so they can see the end result. Monitoring is a very good way of giving you some instant feedback on how different foods affect you. So again, with type 1s, it'd be nice if there was an easy formula for figuring out what kind of insulin you needed. A lot of it has to do with your activity, as I mentioned, what kind of food you eat, how much of it you eat. So again, use those numbers for your own use to see, well, if I eat this and take this amount of insulin, my blood sugar is within range. That's good. Do that again. If you take a certain amount of insulin with a certain amount of food and your sugars are outside the range, obviously you haven't accomplished that goal. So you might need to make some minute changes or call your doctor. Ask your doctor if it's okay with him that you make some minor changes in your insulin dosing so that it all matches up so you can reach the goal glucoses that you all have established together. Most of the time those goal glucoses are about 80 to 120. So you want to keep your blood sugar between 80 and 120. Studies have shown that people who keep their blood sugars less than 140 can decrease the risk of complications by 76%. That's very important. Those complications of diabetes are the eye, kidney, and nerve disease. You want to make sure, and most people think it's very important to be able to see, pee, and walk. So those are the things that you need to look at with your diabetes. So type 1s make no insulin whatsoever. They have to take insulin by injection, and so they are truly insulin dependent. They need to check their sugars very frequently to make sure they're on the right course. Type 2 is a little different animal. Sometimes type 2s can control their diabetes well with just diet. In that case, they might need to check their blood sugar, do self-monitoring, maybe once a day, every other day, maybe more frequently at the beginning while they get a feel for how the different foods affect them and how activity affects them. Some type 2 people need to take pills. Those oral agents can either make the pancreas make more insulin or they can open up the cells to accept the insulin better. Some of the pills work, one of the pills works on the liver. Again, it's important to take your blood sugar on a frequent basis to make sure that those pills are working properly for you and how those pills are, again, interacting with the types and amounts of food you eat. Some type 2s need to take insulin. If they don't make sufficient insulin to maintain a normal blood sugar and keep it within the range, they might need to take insulin injections. When they take those injections, again, there's no magic formula that we can tell exactly how much you need. So the doctor can basically give you an idea of what's going to be. And then you need to, again, do the fine-tuning based on those blood sugar readings you have. So it's very important to check your blood sugars, write them down, put them in the log so you can have some record of them, and then take them to your doctor, your healthcare provider, or your diabetes educator so that you can review them to make sure that you're on the right dose.